Inflammatory bowel disease, IBD, is a chronic medical condition characterized by prolonged inflammation of the gastrointestinal, GI, tract. The two main types of IBD are Crohn's disease and ulcerative colitis, which, although similar in many ways, have distinct differences in terms of location, depth of inflammation, and symptoms. IBD significantly impacts the quality of life of those affected and requires long-term medical management. Types of IBD. Crohn's disease. Crohn's disease can affect any part of the GI tract, from the mouth to the anus. However, it most commonly involves the end of the small intestine, the ileum, and the beginning of the colon. What makes Crohn's unique is that it causes transmural inflammation, meaning the inflammation can extend through the entire thickness of the intestinal wall. This can lead to complications like fistulas, abnormal connections between the intestine and other organs, strictures, narrowing of the bowel, and abscesses. Ulcerative colitis. Ulcerative colitis affects only the colon, large intestine, and the rectum, starting from the rectum and moving upward in a continuous manner. Unlike Crohn's disease, ulcerative colitis involves inflammation only in the innermost lining of the colon. It causes ulcers and open sores, leading to bleeding and diarrhea. Causes and risk factors. The exact cause of IBD remains unknown, but several factors contribute to its development. Genetic predisposition. People with a family history of IBD are at a higher risk. Certain genes related to the immune system are associated with IBD. Immune system malfunction. A misdirected immune response may cause the body to attack healthy intestinal tissues, mistaking them for harmful invaders. Environmental factors. Smoking, especially for Crohn's disease, diet, stress, and exposure to certain infections may influence disease onset. Ethnicity. IBD is more common in people of European and Ashkenazi Jewish descent but is increasing globally. Symptoms. The symptoms of IBD vary depending on the severity and location of inflammation but may include chronic or recurrent diarrhea, abdominal pain and cramping, rectal bleeding or bloody stools, weight loss and malnutrition, fatigue and fever, urgent need to have a bowel movement, reduced appetite. In severe cases, IBD can lead to growth delays in children, dehydration, and systemic symptoms like joint pain or skin issues. Diagnosis. Diagnosing IBD involves a combination of medical history, physical examination, and diagnostic tests. Blood tests. Look for signs of inflammation, example elevated CRP or ESR, and anemia. Stool tests. Rule out infections and detect blood or calprotectin, a marker of inflammation. Colonoscopy, a key diagnostic tool that allows direct visualization of the colon and biopsy of inflamed tissue. Endoscopy or capsule endoscopy, used to examine the small intestine in suspected Crohn's disease. Imaging studies, CT scans, MRI, or ultrasound can assess bowel damage, complications, or strictures. Treatment and management. Although there is no permanent cure for IBD, except potentially for ulcerative colitis via total colectomy, many treatments can control symptoms and promote remission. Medications. Aminosalicylates, 5-OZAS useful in mild to moderate ulcerative colitis. Corticosteroids, reduce acute inflammation but are not for long-term use due to side effects. Immunomodulators, suppress the immune response, example azathioprine, methotrexate. Biologic therapies, target specific components of the immune system, such as TNF inhibitors, infliximab, adalimumab, and integrin blockers. Janus kinase, JAK, inhibitors, a newer class of oral medications for moderate to severe disease. Surgery. In Crohn's disease, surgery is often needed to treat complications like strictures, abscesses, or fistulas. In ulcerative colitis, a colectomy, removal of the colon, may be curative. Lifestyle and diet. Avoiding trigger foods, maintaining a balanced diet, and ensuring adequate hydration can help reduce flare UPS. Smoking cessation is especially critical for Crohn's disease patients. Stress management through counseling or mindfulness practices may improve symptoms. Complications. IBD can lead to several serious complications if untreated or poorly managed. Intestinal obstruction. Colorectal cancer, especially in long-standing ulcerative colitis. Fistulas and abscesses. Severe malnutrition. Bone loss, osteoporosis, due to medication or poor calcium absorption. Extraintestinal manifestations, EIMs, include arthritis, skin disorders, like erythema nodosum, eye inflammation, and liver disease, primary sclerosing cholangitis. Living with IBD. IBD is a lifelong condition requiring regular monitoring and a proactive healthcare approach. With proper treatment, many people with IBD can achieve long periods of remission and lead active, fulfilling lives. Support from healthcare providers, family, and IBD-specific communities can make a significant difference in emotional and physical well-being.